People have a really difficult time breaking addictions, and many times they can't do it on their own or even with support groups. What's very effective is the use of medication-assisted therapy. It, along with other supports and treatment, allows people to successfully get off of illegal drugs and life-threatening drugs and move towards recovery. Central Florida Behavioral Health Network supports recovery with medication-assisted therapy when it's appropriate. Let's look at a program in Tampa run by DACCO.
I think it's really important to look at the numbers that we probably serve here, and this morning we had about 750, 760 people come in for a dose of methadone, their dose of methadone specifically, given by a nurse again, and then they go on to work or whatever. Everyone is urine drug screened at least monthly to make sure they're not using anything else.
Here at DACCO, we treat addiction as a disease. It is a disease. No matter what the substance is that you start taking, it's usually volitional on purpose to self-medicate mental health symptoms, troubles at work or at home, in a relationship, peer pressure. Whatever the reason is, once you start taking a substance and opiates aren't any different for long enough, you change the chemistry of your brain.
A lot of people come into our doors now, maybe because they don't have access to the pills on the street that they used to because the pill mills have been closed down. And also I think when they don't have access to that, they're using heroin or some other drugs that are easy to obtain on the street and cheap.
So we have here at DACCO various forms of medication-assisted treatment to help with opiate use disorders. And if you look at the literature and you look at experience, medication-assisted treatment is very effective in treating opiate use disorders and preventing relapse to illicit opiate use.
Had someone the other day who wanted to go to a private treatment program, couldn't have his iPad or cell phone in the residential treatment program. So once he was detoxed, he decided to come to DACCO because we could put him in intensive outpatient care with an injection of Vivitrol monthly, and that's worked really well for that particular patient. So being able to provide that where other people aren't has been a real coup for state programs and programs that have state funding.
I was on drugs and I decided that I wanted to get clean and sober, and I have tried many ways before and wasn't successful by myself, and I knew I needed the help, so I decided to come here to DACCO.
I was actually referred by the courts to DACCO, which I'm now very grateful for, because if I had continued the course I was on, I can't guarantee, there's definitely less likely chance I would have had such a healthy pregnancy.
We meet with them at least once a month, usually more than that, to make sure that everything's going okay with the pregnancy. We educate them on NAS, neonatal abstinence syndrome, and we provide baby showers for them twice a year that they can come to and get different items as well, which is really fun.
It gives you like a peace of mind to know that you can have a healthy pregnancy and that there's something out there to assist you with it.
Since I've came to DACCO, I do have to say that things have changed drastically, for me. I went from, sleeping on a little, mat, in like a little shack house to I have a 3-bedroom house now, and I have my own car. I have I have work now, and I've been coming to DACCO now for a few years. So, yeah, I do have to say that it has definitely changed my life around for the better.
We see the best outcomes for mom and baby if they start medication-assisted treatment and stay on it throughout the pregnancy.
It's important that we dose you every day, see your eyes every day, make sure that you're safe in your dose, and then we do dose adjustments every day also, so that's really important.
If you really want a different life, and if you really are willing and open, DACCO will meet you halfway. You just gotta want it. And if you do, they will help you with the rest.
I don't gotta worry about being broke anymore, on my last dollar going to drugs. You know, I got money now, I don't gotta worry about that type of stuff. You know, I'm able to take care of my family, and it feels good having, you know, a good family unit like we do have. We've gotten closer because of this help from DACCO.
I call this my magic bus. We decided that if we got a bus and we made ourselves mobile, even though we already had our outreach staff that pretty much take their cars and go to different sites already, if we had a team on a bus, we can go out to particular sites, stay there for 4 or 5 hours, some late afternoons, early evenings, and that way we'd be more accessible. Our main goal every month is to get about 100 people to come on the bus and get some type of educational service, learn about their status. All right, so everybody comes in through this door. And then we ask everyone to just take a seat and wait their turn, and as they're waiting, they're able to access any information that we have on our programs. So just to kind of give you an idea, this would be the example of how somebody would be filling out a testing form and providing services.
DACCO has had a long-standing partnership with us for many, many years. We actually fund some of their programs, and we were happy to bring them on board to our Sulphur Springs Resource Center to help some of our participants.
We represent all of DACCO, not just health services, and being that DACCO is a substance abuse agency, we often have a case manager on the bus that is able to kind of help them navigate through getting into treatment.
Some of the happiest times I have is when people come back to the board meetings here at DACCO and tell their story of how they went through treatment here and how they had their children back, and the difference that the counseling and the results have made in their lives.
The results are definitely better, because if you compare a pregnant woman who's in the child welfare system with case management services, with medication-assisted treatment, child welfare services, then you really meet that family's needs, and so they can parent and they can be reunified with their kids.
They stop illicit opiate use. They return to functioning within their families. They can return to work. Their financial status improves. They become functioning members of society.
Program completion is important because when it gets hard, people quit. So if you've successfully completed a program, you have a really good start to begin your life again in a different place and continue with your recovery.
Behavioral health is essential to overall health. We believe and we know that prevention works, treatment works, and people do recover.